So good morning, everybody. I am Christine Griffin, and as a visual description of myself, I am a white, moderately aged female with above the shoulder hair and wearing horn rim glasses and a navy shirt. Again, I'd like to welcome all of you to our annual Statewide Leadership Initiative Conference, hand in hand, coming together to support diverse families. The mission of Washington Statewide Leadership Initiative, or WSLI, is to elevate family voice, to provide connections so that family voice is respected, amplified, and heard in order to support children and youth with special health care needs and their families at all levels in Washington. It is the vision of WSLI that children, individuals, and families in Washington State, including those with special healthcare needs, be healthy, safe, resilient, and included. We value meaningful partnerships with communities and families so that we can work together towards collective impact, engage in cross-systems partnerships statewide, utilize public health frameworks, and promote equity and inclusion. Our partners are made up of family-led, nonprofit, and community-based organizations who provide training and support to parents of children and youth with special health care needs. At this time, please join me in thanking our planning committee for this conference. Colleen Bradley and Jill McCormick with Family to Family Health Information Center, Tracy Hoppus with Parent to Parent of Washington State, Louis Mendoza with Washington State Fathers Network, Doreen Vandervoort with Pierce County Parent to Parent, Nelson Rascon with Dad's Move, Nikki Dyer with Washington State Department of Health, children and youth with special health care needs, and myself, Christine Griffin, with Washington State Hands and Voices. We'd also like to thank our ASL interpreters, Alita Hill and Doni Ottman, and our Spanish interpreter, Isaiah Vega. If you haven't already, please type in your name, the title, your title, and where you are zooming in from. And again, thank you for joining us. During today's session, we ask that you post questions in the chat and that you also direct your question to the name of the person you'd like to ask so that we can respond appropriately. Now, it is my pleasure to introduce Michelle Hoffman to help us kick off today's conference. Michelle is a family leader in Washington with 3 kids and 2 grandkids. After working at Developmental Disability Administration for 8 years, she worked as the Family Engagement Coordinator at Washington's State Department of Health, Children with Special Health Care Needs. Currently, Michelle manages Children's Intensive In-Home Support Waiver, the State Supplement Payment Program, and Waiver Quality Improvement with Developmental Disability Administration. Thank you, Michelle, for joining us and sharing with us how WSLI, or Washington Statewide Leadership Initiative, began.
All right, can you see my screen?
Yes.
Great, thank you.
Yes.
So as Christine mentioned, I'm Michelle Hoffman, and I currently am working at the Developmental Disabilities Administration. And I'm really excited to have the opportunity to be with you guys today. I really enjoyed working with WSLI, and I haven't been able to spend as much time with them now that I'm at DDA, so I'm really excited to share with you today. So in public Health, the Maternal Children with Special Health Care Needs program has a long history of valuing family input to co-design effective systems of care for children with special health care needs. And Maternal Child Health funds children with special health care needs programs in all of the states and 9 territories, and asks each entity to include family leaders to inform their work. And so in late fall of 2015, DOH was awarded a small mini grant of $10,000 to figure out how to do this more effectively in Washington. And so our original idea was to create a mechanism to connect trained family leaders to inform systems change and improve the lives of children and youth with special health care needs, which we sometimes shorten to call SHISHKIN in Washington State. And so today I'm going to share some of the key activities that led to the creation of the WSLI Coalition, how it began and how it evolved into a more formalized structure of a coalition, and how it's been recognized nationally as a unique model to meaningfully engage families in systems change. In February of 2016, a Washington State team of leaders, many of whom are here today on this meeting, traveled to the New Jersey Statewide Parent Advocacy Network, also called SPAN, to learn about their evidence-based parent engagement program. They actually recognized nationally as a best practice in family leadership and family engagement. And so we wanted to hear about their successful strategies. And so SPAN presented their strategies to engage family leaders from diverse communities to inform systems change. SPAN is New Jersey's family-to-family health information center, like PAVE is here in Washington. They also are the parent-to-parent, and they have a number of other roles where they work with child welfare and children's mental health, and they're really connected across their state. And so we learned that SPAN does a really great job of supporting parents, and their key strategy is really ensuring that they have diverse staff and volunteers who could reach into their own communities to build trust and shared experience. And SPAN wears many hats. They also, besides the F2F and parent-to-parent, they also do the PTIC, which is the Parent Training Information Center that PAVE does to support special education advocacy. And so with all of their hats, they're really a one-stop shopping resource for families with children with special health care needs. However, New Jersey is a very different state than Washington. So culturally, politically, demographically, New Jersey is one of the most diverse. It is one of the most diverse states in the country. They have the highest population density, so they're very, very urban. Washington's moderately dense in the west side, but in eastern Washington, we're very, very rural. And then we have mountains that cut our state in half. So we have a lot of different, unique needs in our state that are different. So we, in addition, we really value local autonomy in our state and having the connection to your individual community. So that statewide one-stop shopping structure was just not quite a good fit for Washington. And so we needed to decide how to take our lessons learned from SPAN and adapt their successful strategies that they have to the unique needs of Washington State families. So in April of 2016, we sent out an invitation to Washington State family leaders to attend our very first planning meeting to create the Washington Statewide Leadership Initiative. We had quite a few folks represented who are here today. So Josie Thomas, who is the Executive Director of Parents Place of Maryland, which is also a similar organization to SPAN, facilitated the first statewide meeting to co-create our vision for WSLI. This was our opportunity to take what we learned from SPAN about the value of connecting parents to a continuum of resources, support, training, and leadership, and address systems gaps in a way that would meet the unique needs of families in Washington. We had about 45 participants from all over the state come to our first visioning meeting, and we supported travel expenses to invite them out of the mini grant that we received. And then we co-created our shared vision, looking at how a statewide coalition with collaboration and connection among these existing organizations would benefit individuals, would benefit those organizations who are serving families, and also would benefit the kids and families that we all serve. And so some of the key takeaways from that workshop that we did was the family leaders said that, you know, it's really beneficial to be able to shift focus from just providing training to families to really incorporating families in all aspects of planning for systems change. Also saving time and money through leveraging partnerships, furthering statewide reach for the family organizations to have connection into communities they may not normally be able to support, enhancing knowledge of all the various networks of available support in local areas, and accessing increased diversity of family leaders to inform systems change. And so by the time we were getting into year 2, we did a business analysis at the Department of Health and looking at how could we organizationally support this new coalition, both internal to DOH and external to those partners who we work with. And during that year, that was when we actually had established WSLI in our contracts, so that all of our contractors working with children with special healthcare needs would be committed to supporting this coalition structure. Developing a more formal framework and structure and incorporating the ability to measure outcomes greatly increased the organizational ability to get funding, because funders want to see that measurable impact. And the partnership really allowed the bigger organizations more statewide reach, and smaller organizations greater connection and capacity for resource. So it really was beneficial to pretty much everybody who is a member of the coalition. So then in our third year, in 2018, a couple of our really key accomplishments there were focused really on our decision to adopt the results-based accountability as a way to learn how to measure outcomes and impact. And we did an RBA roadshow. So the coalition worked with the lead staff at the MCH Workforce Development Center at University of North Carolina, Chapel Hill. And we facilitated workshops on results-based accountability to help family organizations learn how to measure their impact. Feedback from the participants was that this was very welcome and really, really valuable for family organizations, and they could really see how it would help them write grants and get funding for their organization. And so when we traveled around the state to 4 different locations, and 2 of them were sponsored by Parent to Parent, we provided some funding to help them organize in Skagit County and in Grant County. They invited all of their regional and local partners to participate, and this was really a great way that the WSLI structure could support different parent-led organizations around the state to learn some of these key skills. So to inform our common vision, we had workshops and participants discussed our outcome statement and how to see their work connected to our outcome statement, identifying key partners, both as the statewide coalition and as their local community key partners that were really important for their work, and what we know works to help families and to increase organizational capacity. And so we did a lot of hands-on workshop work and then came up with some actionable steps for each organization. So in year 4, some of our key accomplishments were we were able to write up an Innovation Station application and get the Washington Statewide Leadership Initiative Coalition recognized in Innovation Station, which is now renamed themselves to Innovation Hub. This is a database that the Association of Maternal Child Health has that highlights evidence-based practice, and WSLI was recognized as a promising practice. And so that was really exciting. And then we also were really thankful that TAVE was able to develop a wonderful website that has a lot of connection to resources and trainings and opportunities. And then we had a logo designed by the communications staff at DOH after lots of input from our group. So 2020. COVID has likely had the biggest impact on people's lives that we ever could have imagined, and we're all still experiencing these impacts today. This topic could be a whole presentation all by itself, but today I just wanted to acknowledge the great accomplishments of WSLI for sustaining this important work in a time when many things have been stopped in their tracks and frozen in time. WSLI was able to adapt their activities to continue their work by prioritizing some of their funding to get additional equipment, such as webcams, Zoom licenses, and other items necessary to facilitate virtual services and supports. And their strong connection to public health allowed those connected to WSLI to receive resources related to navigating the pandemic, toolkits to access and share resources, and hot off the press guidance about navigating COVID relief efforts, such as federal cash assistance, broadband and telehealth access, access to vaccine and testing sites, just to name a few examples. And so moving forward, there continues to be opportunities to expand the coalition. It has some pretty amazing and dedicated leadership currently leading this effort. There's already a broad continuum of opportunities for families to benefit from WSLI connections and a lot of ongoing opportunities to get involved. WSLI continues to build on the momentum of the work of the last 6 years. The vision of WSLI, children, individuals, and families in Washington State, including those with special health care needs, will be healthy, safe, resilient, included, will be the path, and the family leaders will pave the road. Thank you for your time this morning. It was an honor to have the opportunity to share our history and our path. Now I will pass it back to Christine.